And we are live. Okay, hello everyone. This is Hernan, and it's a real pleasure for me to be once again with Dr. Melvin Elson right here. Hello, doctor. How are you doing?
Good morning. How are you doing?
I'm very well, thank you. I'm glad to be joining you again today because today we're going to talk a bit about training for doctors, which is a strong feature in Dr. Elson's practice. Just so you know, a little bit of history, Dr. Melvin Elson has been training doctors and nurses in cosmetic medical procedures since 1982, primarily in evaluation of the aging phase, botulinum toxin, and dermal fillings. He has trained in 51 countries and in most of the US. He has instructed independently and as well as for companies such as Collagen Corporation, Allergan, Prollenium, Merz Aesthetics, and the American Academy of Aesthetic Medicine. So, doctor, can you tell me a bit what is your main focus when it comes to training other doctors?
The main thing is to do a few things. First of all, patients who come in for aesthetic problems are not sick patients, and the doctors need to learn how to approach these patients properly. What
Right.
do they want? What do they really need? So that I have trained doctors around the world in not only how to approach these patients, but how to evaluate them, because patients don't always know even what's in their own face. So the doctor needs
Right.
to learn and point out to the patient, say, oh, yes, that's right, with a mirror, and say, look, this is what we need to do, and this is how we do it, and this is what I would like to do. Again, I've trained doctors in their own offices, and it works best that way because
Right.
they've got their own patients. The doctors don't have to travel, they don't have to waste their time, they don't have to take courses and things they really don't want to and just sit and wait for something they want. One of the
Right.
other things I found out over the years is that when a doctor goes to train, for example, on botulinum toxin, he gets 20 units to give to a patient. 20 units is nothing when you've got 10 patients, 20 patients. You've got to learn how to do it in a lot of different situations. Same thing with fillers. They're given one syringe of filler to practice on a patient, and that's not good enough. So that if you're doing it on your own patients, with me, showing the patient and you exactly what to do, then you can begin to learn all types of things in a very short period of time and very inexpensive.
Right. Okay. Okay. That makes a lot of sense. And how about the process of someone asking you for training? What are the requirements that you have, or how is the process carried along?
There's so many ways to get in touch with me. Obviously, we're on the web right now, and they
Hmm.
can get in touch with me through the website, drmelvinelson.com. They can get to me and ask questions and so forth on LinkedIn, or they can
Right.
call me directly at 615 403 7546. That is my international cell phone, and we can discuss exactly what the doctor wants or the nurse. I train doctors and nurses, uh,
Hmm.
and how to go about this.
Right. Okay. And when it comes for you to training someone, probably a doctor or a nurse, do you have any special requirements, something that they need to do before you get to their office, something that needs to be complied or something like that?
Yes, first of all, they must be licensed. Believe it or not, there are people who are trying to do these cosmetic procedures who are not licensed at all.
Hmm.
They do not have to be dermatologists or plastic surgeons, but they must be board certified in some specialty. Then I
Right.
can train them, and they also must be able to proceed with procedures in their location. so that if they are in New York, they should be licensed in New York. If
Mm-hmm.
they are in Hong Kong, they should be licensed in Hong Kong. And I
Right.
can come. Their patients will be there. They will be there. I will need the charts on the patients that we're going to be injecting and knowing whether or not they are allergic to anything or on any medication and that sort of thing. But that's all we
Right.
really do.
Okay. Okay. And I'm aware that you have all of that information on your YouTube channel and also on the webpage. Is that correct?
Yes, that's correct.
Okay. Okay. Very good. So now you know, if you want to be trained by Dr. Melvin Elson himself, you may go to drmelvinelson.com/training or write to training@drmelvinelson.com. Thanks a lot for your time, Doctor, and we will see you anytime soon.
Thanks, and I hope to be with you in Buenos Aires soon.
Okay, we will be waiting for you here. Thanks a lot. Bye.
Thank you.